Hello. Thank you for joining us. Today, we will be talking about the importance of the nurse's role in healthcare. Nurses are indispensable in healthcare systems across the world, serving as the backbone of patient care and ensuring that individuals receive the attention, compassion, and expertise they need to recover or manage their health conditions. Nurses play a multifaceted role, encompassing tasks that range from direct patient care to administrative and supportive functions, all of which are crucial to the effective functioning of healthcare institutions. Their importance cannot be overstated, as they are involved in nearly every aspect of patient care and are often the first and last point of contact for patients. One of the primary reasons nurses are so vital is their direct involvement in patient care. Nurses are on the front lines, providing bedside care and monitoring the condition of patients around the clock. Their ability to assess and interpret the needs of patients is critical to preventing complications and ensuring timely interventions. Whether it's administering medications, dressing wounds, or assisting in procedures, nurses contribute to patient well-being at every stage of their treatment. Nurses are trained to recognize subtle changes in a patient's condition, which may go unnoticed by others. Their keen observations can often detect early signs of complications, such as infections or adverse reactions to medications, allowing healthcare providers to act quickly. This vigilance plays a key role in improving patient outcomes and reducing the risk of hospital readmissions. Nurses' ability to act as the eyes and ears for the medical team ensures that care is both comprehensive and proactive. In addition to their clinical skills, nurses provide emotional and psychological support to patients and their families. Many patients, especially those with chronic illnesses or undergoing major surgeries, experience anxiety, fear, and uncertainty. Nurses are uniquely positioned to provide reassurance, explain medical procedures, and listen to patients' concerns. Their compassionate care helps patients cope with the emotional challenges of illness, promoting a sense of comfort and security during a difficult time. Nurses also serve as patient educators. They teach patients and families about disease management, post-operative care, medication regimens, and healthy lifestyle choices. By empowering patients with knowledge, nurses help them make informed decisions about their health. This education extends beyond the hospital, as nurses often guide patients on how to manage their conditions at home, reduce the risk of further complications, and improve their quality of life. Another important function of nurses is their ability to advocate for patients. Nurses often act as intermediaries between patients and the medical team, ensuring that the patient's voice is heard and their needs are met. This advocacy can involve anything from clarifying a physician's orders to ensuring that patients are not subjected to unnecessary treatments or procedures. By advocating for patient rights, nurses help create a healthcare environment that respects individual needs and promotes patient-centered care. Nurses are also central to the coordination of care, particularly for patients with complex, multifaceted conditions. In many cases, patients require care from multiple specialists, therapies, and support services. Nurses are often responsible for ensuring that all the different aspects of care are integrated, that appointments are scheduled, and that communication between healthcare providers is clear. This coordination reduces the risk of errors and ensures that patients receive timely and comprehensive care. The adaptability of nurses is another factor that underscores their importance. Healthcare is a dynamic field, and the needs of patients are constantly changing. Nurses are trained to work in various environments, including hospitals, clinics, home care, and long-term care facilities. This flexibility allows them to meet the diverse needs of patients in different settings, ensuring that high-quality care is available regardless of the location. Furthermore, nurses are involved in research and the development of best practices in healthcare. Many nurses work alongside physicians and researchers to study the effectiveness of different treatments, medications, and care protocols. By participating in research, nurses contribute to the continuous improvement of healthcare practices and patient outcomes. Their first-hand experience with patients provides valuable insights into the effectiveness of various approaches to care. Nurses are often seen as leaders within the healthcare system, influencing policies and advocating for systemic changes. As patient care experts, nurses play a critical role in shaping healthcare practices, such as infection control, pain management, and patient safety. Nurses' input is invaluable when developing healthcare policies, ensuring that they are patient-centered and aligned with the best practices in clinical care. Beyond their clinical and leadership roles, nurses help to create a more efficient healthcare system. By providing direct care, performing routine procedures, and assisting with documentation, nurses free up physicians and other medical staff to focus on more complex tasks. This efficiency improves the overall flow of care and helps reduce wait times, enhance patient satisfaction, and ensure that resources are used effectively. In rural and underserved areas, nurses are often the primary healthcare providers, offering services that are otherwise inaccessible to many people. Nurse practitioners and other advanced practice nurses are able to diagnose, treat, and manage a wide range of conditions, offering much-needed care in areas where physicians may be scarce. Their presence in these communities is essential to improving access to healthcare and ensuring that individuals do not fall through the cracks. The COVID-19 pandemic further highlighted the critical role nurses play in healthcare systems. Nurses were at the forefront of battling the virus, providing care to the sick and managing the logistics of treatment and patient flow during a global health crisis. Their dedication, resilience, and ability to work under pressure were key factors in controlling the spread of the virus and ensuring that patients received the care they needed during one of the most challenging times in modern history. Nurses are also instrumental in the ongoing efforts to improve public health. They are often involved in vaccination campaigns, health screenings, and disease prevention programs, working to educate communities and reduce the spread of infectious diseases. Through their efforts in public health, nurses help improve health outcomes and reduce healthcare costs by preventing illness and promoting healthier lifestyles. Finally, the human connection that nurses establish with patients is invaluable. Healthcare can be a cold, clinical experience, but nurses bring a sense of warmth, kindness, and empathy that helps patients feel cared for and understood. This emotional connection not only improves the patient experience, but also contributes to better health outcomes by reducing stress and fostering a positive attitude toward recovery. In conclusion, nurses are essential to the healthcare system, providing a wide range of clinical, emotional, and administrative services that ensure the well-being of patients. From direct patient care to advocacy and education, nurses play a pivotal role in shaping the quality of healthcare and improving patient outcomes. Their commitment to service, compassion, and expertise is what makes them one of the most vital components of any healthcare team.